Hello there, it is Jacob from AuthenticGayBlog. This is part 3 of my videos about the care review and what needs to happen. The reason there's so many is because this is a very important subject that covers a huge area. You know, the care system isn't just siloed care system on its own. Department of Health, Department of Education, many other organisations, voluntary and community organisations are involved as well. So also in regards to my experience, as many of you know from my videos, I grew up in the care system. I probably spent a year to 18 months between these years of 1 and 5 when I was in and out of care 3 times, and then permanently in care from 5 to 18. I've also worked across a wide variety of organisations and sectors. In my last job, I produced one of the biggest health. I produced one of the biggest health surveys of looked after children and care leavers about physical health and well-being. I produced a resource called 45 Care Leaver Friendly Ways, and I produced one of the first ever commissioning toolkits for local authorities and for clinical commissioning groups to commission services for looked after children and care leavers. So I've quite a lot of experience in regards to that. And I also had heavy input into the report that happened at the end of the project, and I have also spoken at the Royal College of Nurses around the health of looked after children. I have also been involved in a citizen jury for Department of Health England, NHS England, and I was asked to talk at an event with 3 days notice because the person dropped out who'd nominated the health of looked after children as a priority for NHS England, and it was selected to go through as a priority, and I spoke at the main event in the Docklands, and this was attended by various directors of NHS England, so just a little bit of experience. Okay, this is about care homes or residential homes and foster carers and private companies profiteering from this. Okay, a lot of the homes are unregulated, so there's not really a lot of regulation going on for them. They're run by people and companies to make a profit. Yeah, that's right, to make money. So in order to make money, they can't maximize their income, so they can't really increase their income because they will be commissioned by the local authority to do this for a set price. So the only way they can increase profit is to reduce costs, and one of the main costs will be the cost of staff. So they won't pay very much, and they don't pay very much, and the entry requirements are basically A-level standard education. Okay, so I know some are good and some have been, many have been Ofsted and they've got good or outstanding, but I really don't believe that from a lot of anecdotal evidence I've been presented with, and also from a lot of actual evidence. Okay, there's a lot of trafficking of young girls, especially in the care homes. They are a petri dish for recruiting vulnerable young people into criminality. Okay, this is not demonising the young people at all. They're very, very vulnerable, you know, and if you're a young person in a children's home and you're dealing with so much and somebody offers you money to do things, you're going to do it. You know, I know that. I lived in children's homes. You know, it doesn't mean you're a bad person. It just means you're very vulnerable and open to be manipulated and exploited, and that's what it is. It's manipulation and exploitation of very, very vulnerable young people who don't have a lot of adults really looking out for them. especially if they're having, like I've said before, my previous videos, 3 or 4 social workers a year. There's no consistency or stability there, is there? So there should not be any profiteering in this whatsoever. People should not be making profit from it. Right? There might only be 3 or 4 children per home, not like my home. There was 15 of us, but there were lots of staff, and trust me, they were on our case all the time. There's very, very little we could do that didn't get their watchful eye on us. And anything we did do outside of the home got back to the home. So the staff are under pressure to manage very traumatized children who are dealing with very difficult situations in their life and trying to manage a variety of emotions about this and feelings and stuff like that. This requires real expert handling of the situation, and it requires patience, as I've said before. It requires a commitment to these young people around taking care of their needs. Now, you need a lot of training for this. You need a lot of experience. You need a lot of understanding. You need to be able to handle, challenging behaviour in a resourceful way, which doesn't involve restraining that young person. Okay, you need support as well. So you need people you can talk to about the situations that you're dealing with in these environments. Now, when it's all privatised, all of this costs money, doesn't it? It all costs money to employ someone to supervise, for staff to go to for supervision. It all costs money for really good training. It all costs money for all of these things. So it's very unlikely that they will do this, and local authorities aren't always really good at actually, monitoring these situations. They're paying money. They've paid money out of their bank accounts to these organisations to provide these services. Now, they're not always very good at managing these situations, and it's not good because the young people are let down. There are some good care homes. There's some really good experiences from people. I know several people that run care homes that do a really good job of it. But most of those were people who grew up in the system, so they know what it's like. Do you know what I mean? So, and they do really good work with their young people. But quite often, the people who are running these homes don't have a clue at all. It's about profit, really. It's about, what they see as an easy way of making money. And that's wrong. And it's the same with foster care agencies. You're basically, the local authority is commissioning an agency to manage foster carers, so that the money they're paying the agency could be directed solely at supporting and paying the foster carers to do the roles that they're doing, but it's not. It's going to an organisation that has to employ staff to do this, employ social workers to do this, so do you get what I'm saying? There should not be any profiteering in this whatsoever. The money available should be more for a start, and it should be directed purely, solely at running these services, not going to companies that are going to be middlemen and taking a fairly substantial cut of that money themselves, to either pay their shareholders or directors, in profits. And the people who miss out are the young people in these situations, because they're not being supported. And I know, as I've said, we're talking about thousands of vulnerable young people in care homes that are exploited, either sexually exploited into grooming gangs, sexually exploited into selling sex, or exploited by criminal gangs involved in either drug dealing or kind of major theft And where do these young people end up? Most of them will end up back into the criminal justice system and inside, because the people who are exploiting them will do one. You know, the people who exploit them aren't going to be around when they're arrested by the police, you know, and they end up in prison, you know. So there should be no profiteering whatsoever in this, you know. I don't know, I mean the local authority, or there should be independent charities that are running this, that are heavily regulated and have all the right resources, not just financial resources directed at them, but human resources, intellectual resources, experience resources. There should be care leavers involved in this process, you know. So care leavers should be consulted and involved in this process in terms of how these places are going to be run. Thank you.